show. I am Dr. Kay Solar in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And this week we are talking about cervical cancer because January is Cervical Cancer Awareness Month. And thank you so much for joining us. We have Dr. Sobia Ozair, who is a medical oncologist, and you're splitting your time between the lake and Women's Hospital Breast and GYN Cancer Pavilion, right?
Exactly.
They got you on the road running back and forth.
Yes, they do.
So since it is Cervical Cancer Awareness Month, let's talk about cervical cancer, especially here in Louisiana.
Yeah, well, one of the first things to mention is that cervical cancer used to be a devastating disease, used to be one of the most common causes of cancer for women in the United States. However, with the advent of the Pap test, we've seen a great decline by 50% of cases for cancer deaths related to cervical cancer in the last 30 years. But Louisiana, unfortunately, is one of the highest rates of cervical cancer. And so that's why we really got to emphasize screening, seeing your doctors, because early detection saves lives. One of the key things I do want to mention is in 2021, it's predicted that there's going to be 240 cases of cervical cancer diagnosed and 80 deaths. And so the best way to sort of get around that is get your screening done.
And that's just in Louisiana?
That's just Louisiana.
Wow.
Right.
So that's a lot.
And, yes. And I used to say with the Pap smear screening, it is so great. We really shouldn't have anyone dying of cervical cancer.
It's a very, very good test.
Absolutely. So let's talk about some of the risk factors for getting cervical cancer, because sometimes when we go, well, how would I get that? Is it hereditary? My mom or somebody had it? Does that mean I'm at greater risk? Let's talk.
Yeah, so family history is important. If you have a first-degree relative like your mom or your sister, you're 2 to 3 times more likely to get cervical cancer. So definitely important if you have a family history. Another really big risk factor is smoking. Smoking, tobacco, that increases your risk by 2 times a non-smoker.
And that's crazy. When I was practicing, we would go, how in the world does smoking increase my risk for cervical cancer?
Yes.
But, it's one of those things. It's a lot of carcinogens.
Yes.
And also, I know we're going to talk about the fact that it's related to the human papillomavirus.
Yes.
And women who would be diagnosed with that or have precancer cells, they go, what can I do to reduce my chance of this recurring or developing into cervical cancer? One of the biggest things they can do is quit smoking.
Yes, because smoking weakens your immune system. So you're not able to heal as quickly because the body usually takes care of HPV on its own. It's the problem when you have an HPV that the body can't tackle. So nearly all cervical cancers are because of human papillomavirus or HPV, and there's 170 types now known.
Really? Absolutely. That's why women would go, well, because we could screen for some on some of the Pap tests, whether they were high-risk strains or low-risk strains. But that was 4. Maybe by the time I retired, there was like 8 or something. It wasn't 170. So sometimes women would go, well, how did I get this if my screening thing on the Pap was negative? Well, it doesn't look for all of them.
Exactly, and that's why screening is so important.
Absolutely. Well, let's talk symptoms. What should women look out for?
So unusual bleeding. We have menstrual cycles when we're premenopausal. So if you're having irregular bleeding and it doesn't make sense, you're having too much, your cycles are irregular, talk to your doctor. If you're postmenopausal and you're having bleeding, it's not supposed to happen. Your body has stopped that process. So if you're having bleeding, do not ignore it. See your gynecologist.
Absolutely. I heard all kinds of things, and I think a lot of times when we're scared about something, we rationalize that it's something else. And I remember one lady telling me who was like menopausal, and she was like, well, my granddaughter moved in with me and she was on her cycle, and I just thought I started cycling with her again. No, that does not happen. So that is not right. Once you quit and you have been a year without bleeding, you should never bleed again. And if you do, you got to tell your doctor. It may not be cervical cancer, may not be precancer cells, but it is wrong, and it needs to be checked out.
And other cancers can present with bleeding as well, like endometrial cancer. So it is important. It can be something in disguise. And of course, pelvic pain. So if you have pelvic pain that is not going away, is not caused by something else like gas or something like that, you definitely need to get that checked out, especially if it's persistent.
Absolutely. And bleeding after intercourse.
Correct. Yes.
Because of the cervix being more friable and irritated due to the precancerous cells or possibly cervical cancer. So we talked about pap smear screening, and boy, if everybody was getting screened, I think this is one that we could get rid of.
Yeah.
So let's talk about those screening guidelines, because that has confused a lot of women.
Yes, it has. So now the guidelines say that when you're 21, you start getting your cervical cancer screening with a pap test. Between ages 21 to 29, you get it every 3 years. When you're 30 to 65, it's recommended that you get it every 5 years with the HPV test. However, you still see your gynecologist every year. I know it's tricky because insurance companies are sort of covering it in a certain way, but you need to see your gynecologist because they may recommend that you need to get it on the closer end, depending on what your pap test shows.
And of course, it depends on your history, because
Correct.
even those new changes are not set in stone, because
Correct,
they
yes.
mean that you're at low risk.
Yes.
But you don't know what your family history might be, because somebody might develop it or not even tell you that they've had it.
And it's certainly different
or-
if you ever had
Yeah.
precancerous cells that had to be treated as far as your screening frequency. But again, that's only talking about the pap test, which that's something that the patient and their physician can decide on their screening frequency. It does not mean you do not need an annual checkup with your gynecologist.
You got it. And one
So-
other important point is the HPV vaccine's out. And so just because you got the HPV vaccine does not mean you're exempt from getting a pap test. It's still very, very important because the HPV vaccine only has 9 types of HPV
Right.
in the vaccine. And so I just mentioned there's over 170 different types. And so
Right.
you got to still get that pap test because you don't know if you're 100% protected. It's a very good vaccine, don't get me wrong, but you still
Absolutely.
have to get checked out.
It covers some of the most common
Yes,
types, but
exactly.
not every type. So even if somebody has HPV, they still can benefit from getting the HPV vaccine because they may have a type that is not covered.
Correct.
And so it is still beneficial. They're not going to have all 9 types.
Right.
It's beneficial to get the vaccine, and it does reduce their chance of some of the most common strains. But again, does not mean no pap smears.
Yes, and the HPV vaccine now covers a wider range. It's from ages 9 to 45 for men and women because HPV does not just cause cervical cancer, it causes other cancers. Just a little insight there.
Absolutely. And originally when it first came out, it was just for girls,
Yes.
but it has been approved for boys too and men.
You got it.
So people need to be more comfortable even talking about this and
You got
encouraging and asking their loved ones of both genders, have you gone to the doctor? Have you asked the questions that you might think are dumb questions? There's no dumb question.
There's no dumb
Yeah,
questions.
there's
That's
no
what I
dumb
always tell
question.
people. There are no dumb questions.
No.
So now, if someone finds themselves being diagnosed with cervical cancer, let's talk about what they should do, because that's where you come into play.
Yeah, you got to get the best treatment. The Breast and Gyne Cancer Pavilion actually is dedicated solely to treating women with breast and gyne cancers. Mary Bird Perkins, Our Lady of the Lake Cancer Center, and Women's Hospital work side by side in making sure you have the most experienced doctors offering you the latest technologies in treatment and the most advanced clinical trials.
And it's their 50th anniversary.
I know, which
so
is
they've
great.
been doing this very well for a very long time.
And, I know that there's, we can't go into huge detail, but let's talk about how it's treated.
Yeah, so basically cervical cancer in a nutshell is treated with surgery, chemo, or radiation. Early stage cancers are typically treated with surgery or a combination, more so now with chemo and radiation. And if you have a later stage cancer, usually chemo is your only option. But early detection is key. You got to get detected. You got to get your
Absolutely.
screening done, get an early diagnosis, and that way you get the best chance for cure, most likely to have the most successful treatment.
Absolutely. The best thing is to have your pap smear done so you can detect those changes when they're precancerous before they turn into cancer, and have
Yes.
a minimally invasive procedure or close follow-up with your pap smears to reduce your chance of cervical cancer ever happening. But if it can be caught really early, it can be treated with a simple hysterectomy. And so that is the goal, because we need to get those numbers down.
Yes.
For Louisiana, we need to make them
Yes.
0 is what we
Yeah.
need to do.
For sure.
So if people want to find out more information on cervical cancer, tell us the best spot to go.
So the best spot to go is the Breast and Gyne Cancer Pavilion or breastandgynecancer.org.
Absolutely. So we want to know, we only have about a minute left, but
Okay.
we want to know a little bit about you. How
Okay.
long have you been here?
Yeah,
And,
so I moved here in 2018. I trained in New Orleans. I'm married and we're both happy to be in Baton Rouge. So yeah, we definitely enjoy it here, and I love what I do with cancer care.
That's wonderful.
Well, we want people to give you a call.
Yes.
Yeah, we hope that when they come to see you, it's early stage.
Right, so
but
we
if
can get
not,
them the
we know
best
that you'll be
possible
able
treatment.
to take care of it. And that's so important.
Right.
Encourage somebody to go get tested, make sure that they get screened, and do whatever they can do to keep themselves healthy.
Absolutely. And we've been talking with Dr. Sobia Ozair, who is a medical oncologist with Mary Bird Perkins, Our Lady of the Lake Cancer Center, splitting her time with the Breast and GYN Cancer Pavilion over at Women's Hospital. She's on the road taking care of folks. Thank you so much. We appreciate
Yes.
you being in the studio with us
Thank
this
you.
week.
Glad to be here.
And Betts, up next.
Up next is Aaron Hogan. I cannot wait for you to see his beautiful photography with I Wander Photography.